Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. Today we're going to talk about Alzheimer's disease, the most common type of dementia impacting over 11 million women, specifically in America. It is a progressive disease beginning with mild memory loss and possibly leading to loss of the ability to carry on a conversation and respond to the environment. My guest today is Emma Kaye, a neurology nurse practitioner at the Neuroscience Institute at Great Neck, part of Northwell Health. She focuses her work on dementia and Alzheimer's disease along with general neurology. Emma, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you. Thank you for having me today.
So I understand that you're trying to raise awareness of Alzheimer's disease and how it really affects women in very new and interesting ways. So tell me more first about you and why you decided to focus your work on Alzheimer's disease in this important area.
Yeah, so with Alzheimer's disease, 6.5 million Americans are actually diagnosed with Alzheimer's disease, and the number is just growing tremendously year after year. And there's so much that people don't know, or they're not doing the things that they should be doing to kind of slow down or prevent Alzheimer's disease from, occurring. And that goes along with, brain health. So we talked a lot about, cardiovascular disease, but we never talk really much about brain health and how what we do on a daily basis, affects our brain health, whether it's controlling our blood pressure, eating a healthy diet, exercise, all of that affects, our risk for Alzheimer's disease and other dementias.
Has this affected you personally in your family or someone close to you that you know?
It hasn't affected my family, but it has affected a lot of my friends and their families. I actually just did an Alzheimer's dementia walk for the Caring Kind of New York City. So I was there to support and raise awareness for Alzheimer's disease. And I just gave a talk for the New York Teachers Association about Alzheimer's disease and other dementias and how we can reduce the risk. So there's a lot of people out there, because the people out there is my community. So my community is my family. So there are a lot of people who are affected by this.
So I'm hearing you've gone TikTok famous for this awareness that you are getting out there. Tell me a bit more about that.
So for the awareness, so I'm a part of the Caring Kind of New York City, and what they do, they have a lot of great resources for families in regards to what Alzheimer's disease is, how to get caregiver support, what the process is, what is Alzheimer's disease, and with things that, they have services as well to learn about all the other barriers that come along with this in regards to getting caregivers, insurance, caregiver stress, things like that, and how to control symptoms. So this is a great resource for patients and families to learn more about. And for me, myself, I am a big marathon runner and I do a triathlon. So for me, at least, I like to raise money and spread awareness for these causes.
So these marathons that you like to involve yourself in, how much money have you been able to raise for this wonderful cause?
So far, I raised $5,000. Awesome. That was the most recent for a fundraiser for the Alzheimer's and dementia Caring Kind of New York City. So that was the most recent in May. And there was a lot of people who came to support this. So I hope for the next one, the United Airlines half marathon, I'll be able to raise more money than that to spread awareness and increase funds for research, because there's so much still that we don't know about Alzheimer's disease. And again, there's still no cure. There's only medications that have kind of slowed down the progression of the disease.
So where are the marathons? Where was the last marathon that took place?
Yeah, so I do triathlons as well. The last half marathon was in the Hampton. No, that was a triathlon.
Oh, okay.
My last half marathon was actually the women's half marathon of New York City.
Nice.
It was in Central Park. There was 5,000 women. I came in 5th place.
Oh, wow. That's awesome.
Yeah. Yeah, so that was really great.
That's good.
Yeah, super exciting. Science. My next one actually is going to be a full marathon. It's on my birthday, January 28th. It's
nice.
The lifetime full marathon.
You got to let me know about that so I can join you. I love marathons.
Yeah, of course. Yeah, I'm super excited.
So I also heard about this release of a new book, Navigating Brain Health to Help Caregivers. Tell us about that one.
Yeah, so in the future, after I finish my doctorate, this Friday, I graduate. I definitely want to start to write a book for patients to help navigate care. As I see many patients and their families, there's so much that they don't know in regards to things they can do to help kind of build their cognitive reserve. Mm-hmm. Patients, I see sometimes they feel like it's too late to do anything, and they get into this rut where they're kind of just sitting at home watching TV and just kind of losing hope. And I give them the hope to not give up and things that they can do to help to increase their cognitive reserve and neuroplasticity to help them function at their level or to do better. So I want to write this book to explain to patients what Alzheimer's disease is, what is dementia. People get confused with the term dementia all the time. Mm-hmm. There's a big discrepancy between dementia and neurodegenerative diseases. So I want to clarify that and give all the resources and the medications and how it works in the brain so people can really understand the whole idea of dementia, Alzheimer's, and what we can do to slow things down, because this doesn't just happen, when we're in our 60s or 70s. It actually starts in our 20s and 30s. We just start exacerbating with symptoms when we're a little bit older.
So tell me, what exactly is going on with Alzheimer's? I know about the neurofibrillary tangles and that changes. How does that differ from other kinds of dementias? Can you basically give us a brief overview of the different dementias that we might see?
Sure. So let me just start with Alzheimer's disease. So Alzheimer's disease is the buildup of amyloid plaque in the brain. It's a protein that's disrupting the neural network, right? Then we have frontal temporal dementia, right? This is the dementia that we see with a tau protein. Now, the difference between, Alzheimer's and frontal temporal, Lewy body, which is alpha-synuclein, is the protein that is accumulating in the brain. Right, they're all different types of proteins, and they present, with different symptoms. So with Alzheimer's disease is actually, we should make it a syndrome, not a disease, because people associate Alzheimer's disease with memory loss, rapid forgetting. Yes, that's it. But there's also other different variants of Alzheimer's disease. There's posterior cortical atrophy, where the back of your brain, you lose volume and you can start having, visual disturbance. Right. You can also have other symptoms as well. There's Lewy body disease. Lewy body disease is another type of dementia as well. I think we all know some, famous people who have been diagnosed with this. And Lewy body disease, it can present with hallucinations, REM sleep disorder. And then we also have vascular dementia, where I think this is the most common, and what I see in the practice. It's basically an accumulation of plaque in the brain from high blood pressure, high cholesterol, diabetes, that causes a disruption in the network. So it's like silent hypertension, but causing changes in the brain.
So how does this begin, and what do patients present with? If I would characterize an early onset Alzheimer's, what may be some presenting symptoms that I might see?
Yeah, so some presenting symptoms, if a patient or someone is rapidly forgetting, like you would tell them something and then they don't know, they don't remember. But if this happens consistently, because here and there we forget, we're not present, right? So that's one sign. And there's another sign of, misplacing items very frequently, right? So that's another sign. Getting confused, getting lost, going to familiar places.
And so as Alzheimer's progress, how severe can it become? Can a person be completely debilitated from Alzheimer's? So as it progresses, as it starts to affect the entire brain, right? Patient can present, with like Parkinsonian type features where they're very confused and they can't take care of themselves anymore. We call these activities of daily living and instrumental activities of daily living, where they can't bathe, dress, hydrate themselves. They lose their speech, right? They have difficulty talking. They can't write. So it can advance to that stage. So as you are describing it, I'm looking at the different angles that this can really affect. So it's just not a physiologic change. It affects them socially, their ability to engage in relationships. It affects them spiritually and how they are able to connect with a higher power. Explain all of that.
Yeah, so sometimes patients, they see the symptoms starting in themselves, and they'll actually disengage themselves from being with their friends or going out and doing things that they used to do because they feel embarrassed with what's going on. Sometimes these patients can present with difficulty, speaking, or they can't really understand, or they don't know what to say. So most of the time, the patients can start becoming, depressed and lonely and, lose that function. And when you start to become more to yourself, it can affect your mood emotionally, and then you lose sight of everything else in life.
Quite involving and in depth this disease can be. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about Alzheimer's disease, the most common type of dementia impacting over 11 million women, specifically in America. My guest today is Emma Kaye, a neurology nurse practitioner at the Neuroscience Institute at Great Neck, part of Northwell Health. She focuses her work on dementia and Alzheimer's disease, along with general neurology. So as we were talking about Alzheimer's disease, I'm seeing new studies that found CBD and marijuana as having some potential impact upon this disease in terms of prevention or slowing up the progression of the symptomology. What are your thoughts about that?
Yeah, so with CBD, there's actually no studies out there. There's, patients who have tried, CBD and these new remedies, which can help calm the patient, help them feel better. But there's no actual study showing that it slows down the progression of Alzheimer's disease.
So what are people actually seeing with the use of marijuana? Is it just the fact that the mood elevation, or what possibly can be what people are seeing?
Yeah, so marijuana can help with the mood, calm the person down, right? It has the physiological effects of behavior, mood, how you're feeling, just puts you in a less stressful state, right? So on a metabolic level, cognitive level, is it doing anything there? Not necessarily. I think it's just really affecting the patient's or the person's mood more so.
Yes, I think so too. So is Alzheimer's genetic? If your mother had it, your grandmother had it, is it likely that you're going to have it? Is it familial at all?
Yeah, so there's part of it is genetic, and then part of it is also sporadic. And as you get older, patients are more at risk for Alzheimer's disease. just because the brain is more susceptible to changes, metabolic changes, and everything happens on a metabolic level with the mitochondria. So that's where the proteins can get disrupted and misfolded and increase the risk. So it's not 100% genetic, but genetics do play a role in Alzheimer's disease, definitely. And if that's the case, if there's a high genetic risk, then we do screen the patients clinically, if we feel that they are presenting with signs of Alzheimer's.
So how is someone diagnosed with Alzheimer's disease?
Yeah, so we can diagnose Alzheimer's disease clinically. So depending on what the patient's presenting with, what they can do on a daily basis, if they need more supervision or help with the activities of daily living. We can also see on the MRI of the brain if the mesial temporal lobe, if it's the volume, if there's volume loss there. Mm-hmm. We can see also the ventricles if it's a little bit more displaced, and that will also show if there is some attributable volume loss. But to really diagnose Alzheimer's disease, it's really the amyloid PET scan, which will show amyloid in the brain, and a cerebral spinal fluid, which will also show amyloid in the spinal fluid. But we can diagnose pretty much clinically with the MRI and a PET scan. A PET scan shows if there's decreased uptake of metabolism in certain parts of the brain. And again, you would see this in the mesial temporal lobe, the cingulate gyrus, and the temporal area in the brain.
So would this considered to be curable at all, or just treatable?
Unfortunately, there's no cure. There's only ways to slow it down.
Yeah, talk to me about prevention. What are some of the things that we can do to prevent Alzheimer's? Yeah,
so let me first talk about the drugs that we use for Alzheimer's disease. So for patients who are mild, there's a drug called cholinesterase inhibitors. And what this does is that the whole theory behind this is that when you have Alzheimer's disease, you have a decreased uptake of the neurotransmitter acetylcholine that helps the brain communicate. So using this medication, it can increase uptake of acetylcholine, which then helps the brain communicate and globally helps the brain work a little better. Other than that, I also suggest, as a prevention, that patients eat, we call it the MIND diet, mostly Mediterranean, fish, whole foods, fruit, vegetables, things like that. Exercise as well. Exercise has shown to also play a huge role in metabolic health, increasing blood flow, hippocampus, neuromodulation with the neurotransmitters. Also, patients, what they can do as well is to stimulate the brain. It's really important to stay engaged every day by reading. Reading is great for the brain. It stimulates the speech and language center of the brain. Being engaged, doing things that you like. I always don't suggest watching TV because watching TV does not stimulate the brain at all. Anything that keeps the brain stimulated, whether it's reading, doing challenging tasking.
Yeah, I'm hearing even learning a new hobby kind of creates those new pathways.
Playing, learning a new language, playing music, anything that engages the brain.
So how early are medications introduced to prevent progression of this disease? Is it as soon as the MRI, CAT scan is positive, do you start medications, or is there a particular time when medication regimen is begun?
So usually clinically, if we see that the patient has a mild deficit based on our exam and their clinical symptoms, we can start medication then with the cholinesterase inhibitors. Usually when the patient is more advanced, the cholinesterase inhibitors, it's not very useful. We usually go to the NMDA inhibitors, which is memantine, which is supposed to decrease neurotoxicity in the brain. But we can definitely introduce the other drugs when the patient presents more mild.
So with everybody who has Alzheimer's, is it all seem to be equal in terms of how they present, or do you find that some people are more symptomatic, if you will? Some people, you see more symptoms even though they have the disease, whereas some people, they don't show symptoms at all.
So usually patients are always coming in with some type of symptom, right? Either it's short-term memory loss, they'll be forgetting, repeating themselves, asking the same questions, or they're having like anxiety, a lot of anxiety. And then when we always ask patients to draw a clock, right? To draw a pattern, to do a couple of things on exam. Sometimes there's red flags that stand out to us, which can give us a clue. So sometimes, the patient may seem normal, right, when you're talking to them, but when you start doing the exam, when you're asking them specific questions like to subtract backwards, recall registration with recalling words, drawing the clock, sometimes we see a disruption there.
Yes, sort of a degeneration over time. Who does usually brings the patient into you? Is it the family member or is it the patient that comes in that says there's something there's something that's going wrong here?
Usually both. Usually it's both. Sometimes, we get patients even very young, like in their 30s and 40s, because they also feel like they're having some memory issues. So a lot of people that, there's a lot of people that ranges from, early 20s to, in the 90s that we see who come in for memory issues or a speech issue, some cognitive issue that they're concerned about.
Yeah. So when you're talking about speech, is the recall of words or maybe drawing something simple, they can no longer draw it, or maybe going to a place that they've always gone to, they get lost.
Something like that. Sometimes they present with speech issues where they have word finding difficulty. That's also a memory issue, right? Where you can't find the words. Sometimes they're not speaking fluently, or they'll start pausing when they're talking. So that's more of an aphasia, that what we call. Not necessarily Alzheimer's. That would be a different variant.
Okay. So what do you think is the most challenging with dealing with patients who have Alzheimer's, either for them or for their family?
Yeah. So I think the most challenging part is for the family is for them to see the progression. Sometimes, the patients, get agitated, or they're not sleeping at night. They can't be left alone, so it's a lot of caregiver strain on the family, and really much, I think, controlling the symptoms as well when it comes to agitation. When the patients with their family, they're argumentative, they want to drive, and they're not safe to drive anymore, and it's a big issue because they don't want to lose their independence, and taking away the keys from someone is not the easiest thing to do.
So for someone who is driving that has Alzheimer's, what is the process, if you will, for them either losing their license or ability to drive? Is that something that's automatic, or what is that? So first, we'd pick that up from my exam, and then I do tell the patient and the family, I don't think it's safe to drive. Sometimes, the patient will be reluctant, so I will have them go for a driving evaluation. And that's the Fitzgerald School of Driving in Deer Park. If that's an issue, then we call DMV. We also get social work involved in this as well, and they reach out to the DMV, and we try, if we can, to get the license revoked. So it's a process. It's not very easy, but we try to be very conservative first, and to show the patient, that we're concerned, and to do everything before contacting the DMV service and getting the license revoked if they're not compliant. You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about Alzheimer's disease, the most common type of dementia impacting over 11 million women, specifically in America. My guest today is Emma Kaye, a neurology nurse practitioner at the Neuroscience Institute at Great Neck, part of Northwell Health. She focuses her work on dementia and Alzheimer's disease, along with general neurology. So, Emma, what about this? It's mostly you're seeing women. So it's a disease that is predominantly seen in women. And has there been any studies as to why that is?
Yeah, as you know, as women, estrogen plays a huge role in cognitive health, and estrogen plays a huge role in metabolic health as well. So when women lose the estrogen over time, it actually increases the risk of Alzheimer's disease. And that's why it's more prevalent in women than men, because of the estrogen component.
That's very interesting. So is there any specific personal case that you have that you want to share of someone that either improved with the medication regimen, or I know the excellent care that you are giving at Northwell Health? Anything you want to share?
Well, all the time I have patients who actually, I speak with them on the phone. They actually feel better, the family and the patient, when they're mild, because, they feel supported. They feel like they're heard. And, I let them know at the end of the visit what I'm concerned with, whether it's them not getting enough sleep at night, because sleep is a huge issue. And when you have this condition, if you're not sleeping, your cognition is going to be completely depressed. Where if they're not eating well, right, if they have diabetes and a lot of vascular risk factors, I address that in the visit. So there's a lot of things that I address. And if these things like diet, exercise, what they're doing on a daily basis, if they're not engaged, I make sure that I give them the resources to go to recreational centers, to go to the library, to keep their brain stimulated. Just a lot of preventative health measures. Yes. When it comes to this. So when I address these issues, patients are willing to make changes. And I always tell them at the end of my visit to follow up with me in 2 weeks so I can see if there's any progress. And sometimes when I see them for a follow-up visit, there actually is, they're doing better, especially when I do start them on the medication as well. Just putting all this together globally with their cognition, they feel that they're doing better, and so does the spouse.
That's good. That's great. So where can someone find out more information about you and your work?
Find me on Emma Olivia 28.
Spell that.
You can also just type my name in on Google, Emma Kaye, and you'll find me on Northwell.
Can you spell that name for us?
EMMAOLIVIA 28.
Okay, and where else could we find you?
So you can also find me on the Hofstra website. I was also I started a nonprofit for women's health back in 2021. So I'm also on the Hofstra community events website. I'm also on TikTok as well. I make videos for brain health, so I can also be found there.
Absolutely awesome. So we're going to check you out. From a nurse practitioner to a nurse practitioner, thank you for being here. Emma Kaye, a neurology nurse practitioner at the Neuroscience Institute at Great Neck, part of Northwell Health. We want to thank you for giving us all this important information today, and good luck with all that you're going to do in completing your PhD.
Thank you so much. I appreciate it. And thank you for having me.
You're welcome. This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.